It is time now for our Vidant Spotlight. We're always happy to welcome folks in from Vidant Health. We're so fortunate to have Vidant Health in Eastern North Carolina. They've changed medical care forever here, and we have a lot of great folks that come here from other parts of the country that are contributing to healthcare in Eastern North Carolina. We're going to meet a couple of them. In fact, one that came here from Philadelphia last year. We're going to talk to him in just a second. Let me welcome in Jordan Sheets, who is a stroke nurse navigator at Vidant Health, and Dr. Richard Dalyai, who is a neurosurgeon with Vidant Neurosurgery. Good morning, folks. How are you?
Good morning.
Good to see you. Thanks for coming in.
Yeah.
It's National Stroke Awareness Month, Doc. And, is it true that Eastern North Carolina is the stroke belt? Do we eat too much barbecue? Is that the problem?
It is true. I don't know if it's the barbecue, but, the statistics of stroke in this area is pretty alarming. A citizen of North Carolina, specifically Eastern North Carolina, is about twice as likely than your average United States citizen of suffering and dying from a stroke.
That's pretty amazing. Twice as likely.
Twice as likely.
Is it because we don't exercise enough? I mean, is it lifestyle? Is it the way we grow up here? What is it?
Yeah, we think that there's a lot of factors. There's several factors that weigh into it. Diet's probably one of them. Lifestyle, physical activity, genetics is a huge component. There's actually known to be some racial components and disparities. We don't know why all the factors are there, but we do know that they've met in several factors line up in this area that makes it more prevalent than elsewhere in the country.
That's frightening to hear, actually. I'm going to the gym right after this interview. So we'll come back to you because I want to talk about things people can do to prevent strokes and how to know if you're experiencing a stroke. But let me bring Jordan in. We've had Jordan on the show before. How are you?
Yeah, I'm doing great.
Nice
Glad
to
to
see
be
you.
back here. Yeah.
Jordan is a stroke nurse navigator at Vidant Medical Center here in Greenwood. What do you do?
Yeah, so the navigator role is pretty unique. I get to do all of our community outreach and prevention for stroke, so focusing on the primary prevention aspect. And then in the inpatient side, after patients have had a stroke, I kind of get to follow along with them and their families and try to navigate them through the very complex health system. Stroke survivors have a lot of disabilities sometimes afterwards, and so it's navigating physical therapy, occupational therapy, speech therapy, primary care, neurologists, neurosurgeons, trying to set them up with the best possible discharge plan, the safest plan, and really trying to reintegrate them into their community, not just the patient, but the family. And so then after people go home from the hospital, I get an opportunity to still follow them and work with them and do our support group at the hospital and really just try to make sure that we are providing the best care possible all the way through the care continuum.
It's amazing. I mean, I never heard of a nurse navigator until a few years ago, and that concept has really caught on, and it's big at Vidant Health. You guys have a lot of navigators and nursing.
Yeah, over the past few years, the concept has really grown, and we're just seeing such a huge benefit.
Yeah, that's great.
Yeah.
Again, if you're just joining us, Jordan Sheets is with us. She's a stroke nurse navigator at Vidant Medical Center. And Dr. Richard Dalyai is a neurosurgeon with Vidant Neurosurgery. Doc, let's go back to you. Tell us how to prevent a stroke.
So the things that we advise our patients and all the patients are, getting to a doctor, following up with your primary care physician. You want to the normal things you want to eat healthy the way you should be, physical activity and fitness, doing the right things. Those are the major things that you can control, those risk factors that you're able to do, preventing obesity that reduce your risk of having a stroke.
And let's say that that you are having a stroke, which God forbid, but people do.
Yeah.
So, what are the signs that you should get help and seek help right away?
Yeah. So, the big acronym that we kind of for our public education is that FAST, act fast. So if you have any signs of yourself or a loved one, a family member, of any kind of facial weakness or any kind of arm weakness, any issues with their speech where they're slurring words or they're not able to find their words, those are the different things that we say to act in a timely manner as part of the acronym to get to an hospital. For so long, for years, we've had really limited interventions with what we can do if a patient's having a stroke. But the faster that we can, now we have surgical options that weren't available 5 years ago to take the clots out and to kind of surgically cure a stroke. So we try to advertise that it's a time-sensitive disease to get to the hospital, to call 911. To get to.
Is there also? Do I remember there's something about tingling in your fingers and that? Is that something to worry about?
Yeah, absolutely. You know, there's the neurons that the brain cells operate. There's those that control motor, and those are the more obviously for someone, but that paresthesias is what we call them. That numbness and tingling, or the loss of sensation on one side of the body. As well could be a sign of a stroke.
You know, you hear of younger people having strokes.
Yeah.
Yeah. Is that normally a family history problem, or?
Yeah, it does run in families. I mean, there's a strong genetic component, and who knows where we'll be 10 and 15 years about diagnosing or screening patients based on genetics. But we do know there's a significant family history component. There's strokes in young is a big thing. About 25% of our patients that have a stroke are younger than 50 years old. Whether that's sometimes different traumas could cause a stroke, or what we call dissections to the vessel, or injury to the blood vessels, which cause a stroke. Some patients have plenty of other different disorders that can cause strokes in young, and stroke is the number one disorder to cause a disability for American citizens.
Jordan, anything special going on at Vidant this month that you want to mention about stroke prevention?
Yeah, so we're really trying to do a lot of outreach events, just like Dr. Dalyai said, trying to get people to understand those signs and symptoms of a stroke, the importance of calling 911 right away. This Saturday on May 19th, we'll actually have a stroke screening at 3rd Street Community Center, and so that'll be an opportunity for some people in the area to get their cholesterol levels checked, their blood sugar, their blood pressure, and just kind of us have an opportunity to go over their risk of having a stroke with them. 80% of strokes are preventable by controlling those risk factors. So we are really trying to do some work on that end. And then just any opportunity we get to raise awareness. And last week we actually celebrated our stroke survivors with a cookout and from our support group. And they brought their families, and we had a chance to reflect on what they've gone through and their hope and their challenges and all those things. So yeah, this is an exciting month for us. It's a busy, exciting month.
Sounds like a lot going on. And back to Dr. Dalyai again, Richard Dalyai. And I haven't asked you, I probably should have started with this, because I'm always interested when we have these great doctors come to us from other parts of the country. You came here from Philadelphia.
I did.
Yeah.
I did.
And how long have you been here?
2 years.
Yeah.
So
tell us about your journey to, how did you end up at Vidant Health?
So when I went to school in Boston, did my training in Philadelphia. So I like to say I was kind of working my way further down south, outside of a Yankee territory. But
I referred to him as a damn Yankee in the lobby. Now I feel bad about it. So
no, don't feel bad.
Because you know the definition. You've heard it. The ones that come and stay. But look, we're happy you're here. We love to see the great doctors come to Vidant Health.
Yeah, but it's been great. My family, we've been very happy with North Carolina and Greenville. We like being towards the coast and the water. The warmer winters have been nice.
You consider this a warm winter?
If
you grew up in
Boston. I was
Boston.
going to say the winter before was this year was a little bit. It was much better than Boston. I'll put it that way. Yeah. But and,
see, and this is the worst winter I can remember.
Yeah.
It was not a lot of snow, but it was just so.
The winter
cold.
before was very nice. But even this winter has been a much better climate change in Philadelphia.
Yeah, good.
So
well, it's great to have you here.
It's great
to have you here. We appreciate all you do. And anything else, Jordan? Anything? What have I missed? Anything you want to mention?
I don't think so. Dr. Dalyai touched on it a few minutes ago. The landscape of stroke has changed so much in the past 5 years, and it's an exciting time to be a part of it at Vidant Medical Center and with Vidant Health. And so we are at a good place where we're able to really provide interventions for patients that are having a stroke. And, you know, back to just the disparities we were talking about earlier, Eastern North Carolina has a really high rate of uninsured and underinsured. And so seeking a primary care provider, getting established with a primary doctor is one of the biggest things that I can say for stroke prevention, because they're able to catch all of those things much earlier, so that we're not catching them after someone's had a stroke.
Yeah, great.
Yeah.
Dr. Dalyai, anything else you want to mention?
No, the only thing is that the team at Vidant has been fantastic. Jordan, the stroke team, the neuroscience team that we've had significant growth since I've been there. The interventions that we do for stroke, just 2 years ago, we were only doing 5 interventions a year. The year after, we did, by 2016, we did 40. Last year, we were up to 92. This year, we're on pace for 130. So the volumes of strokes that we're seeing have increased, and the things that we're able to do for these patients has rapidly increased as well. So,
Thank you both for being here.
Yeah.
Stroke Awareness Month, and of course the prevalence of it in Eastern North Carolina, pretty strong. So good information to share this morning. Thank you both for being here. It's nice to meet you, Doc.
absolutely.
Dr. Richard Dalyai, got it right up to the very end, and Jordan Sheets, who is a stroke nurse navigator at Vidant. Good to see you both. Thank you for
Absolutely.
coming in.
Thanks for having
Thank
us.
you.
All right.